Carry on, please.
Dear colleagues, I want to give you some information about the classification of miniaturized PNL, and I try to answer the question whether it is possible, and if it is possible, how we can do this. Mini PCNL is not only a miniaturization of standard PCNL. This is very important to say. I'm going to explain this later on. And there are lots of different terms to describe mini PCNL. Almost every publication is using a different definition of mini PCNL. And there's another challenge. This is the ongoing development of new instruments with different diameters. The introduction of mini PCNL was in 1999, and since then we have multiple different instrument diameters which are all called mini PCNL. And another important point is that the combination of the instrument cross-section and the track diameter is very, very important, which means we should not only talk about the diameter of the mini PCNL. And another point is very important. Up to now, there is no international guideline available who is mentioning the term mini PCNL. In fact, this means that mini PCNL is not existing from the viewpoint of the guideline panels of the AUA and the EAU. If we have a look at the guidelines of the European Association of Urology about urolithiasis treatment, only conventional or standard PCNL is mentioned, and there is a clear indication for stones that have a diameter more than 2 centimeters. But there is absolutely no information about the term mini PCNL. I already mentioned that mini PCNL is not only a miniaturization of standard PCNL, and by means of this table, I want to explain what are the real differences of mini PCNL to standard PCNL. At first, there is a kind of tract dilation. In mini PCNL, we are using a so-called single-step dilation. If we are performing a standard PCNL, we normally use multiple steps. We are using the plastic dilators, or we are using the so-called Alken dilators. The track diameter in mini PCNL is smaller than in standard PCNL. There is only 20% of the cross-section of a standard PCNL in mini PCNL. The type of stone disintegration is completely different. If we are performing a mini PCNL, we are always using the holmium laser. We do not make use of ballistic lithotripsy or ultrasound disintegration anymore, as we did this in conventional PCNL. If we are performing a mini PCNL, the stone removal is done without need of a grasper, without any basket or something like that. The stones are washed out by means of the irrigation flow. This effect is called the so-called vacuum cleaner effect, which is completely different to conventional PCNL. The stone-free rate is comparable, of course. The nephrostomy tube in mini PCNL is very small, usually about 12 French, or we are performing a so-called tubeless PCNL. In standard PCNL, we frequently use a larger nephrostomy tube, approximately 22 French. And there is a significant difference in the transfusion rate of these both different types of PCNL. This means, as I already said, mini PCNL is not only the miniaturization, and there are a lot of significant differences. Mini PCNL is a complete different method of stone removal And the characteristics of mini PCNL, and these are the important things to talk about the classification, are not only depending on tract size, but also on the combination of the nephroscope and tract size. If we have a look at the development of PCNL, it started in 1941, where the first stone removal via open surgical nephrostomy was done. Later on in 1976, Fernström and Alken described the conventional PCNL technique. And in 2001, the first mini PCNL nephroscope for application in adults, not in children, in adults, was described. And later on, there were some other working groups around Nagele, Bader, and Desai and Seng, who showed modifications of the so-called original mini PCNL. Now, what are the different types of mini PCNL today? It is the original form of mini PCNL. It is ultra mini PCNL, super mini PCNL, enhanced super mini PCNL, micro PCNL, perfect PERC, and standard PCNL. Let's have a look at the different types of these mini PCNL instruments. This table shows the instrument diameter and the tract diameter. Tract diameter means the outer cross-section of the amplet sheath used. And I try to make a certain order from smaller instruments to larger instruments, but you can clearly see that there is a great variety of different instruments diameters which are combined with different tract diameters. And therefore we always have to talk about both instrument diameter and tract diameter, because the difference between instrument diameter and tract diameter describe how large the space between the nephroscope shaft and the amplat sheath is. And this is the main influencing factor for the so-called vacuum cleaner effect. This table also shows that some instruments, for example the perfect PERC, is available with one instrument diameter, which is very small, in combination with different amplat sheath. Therefore, the classification of mini PCNL is really very, very difficult. A few years ago, there was a letter to the editor of the World Journal of Urology, and there were some colleagues who had a proposal for a classification of mini PCNL. They described a special classification where the patient position was mentioned, the outer sheath of the amplat sheath, the irrigation flow, the urinary diversion after the procedure, and the tract treatment. Unfortunately, this proposal of classification was not accepted from all the other urologists. I also think that this classification is not suitable because you cannot clearly see what they really used, and maybe this is the main reason why this classification was not accepted by all the other urologists. What we need is an accepted definition of mini PCNL, which is not available yet, but this is really strongly needed. And it is questionable whether only one definition of mini PCNL is suitable. Mini PCNL is a so-called umbrella term for all miniaturized types of PCNL. And a sub-classification of mini PCNL is recommended by mentioning the outer diameter of the tract. From my point of view, it is suitable to have a definition of mini PCNL which tells us first that this is a mini PCNL, and mini PCNL is any PCNL that is performed with a tract diameter of less than 22 French. Once more, mini PCNL is everything percutaneous with a tract diameter less than 22 French. This is independent from the nephroscope used. And the term mini PCNL always requires a specification of the instrument cross-section and the track diameter. For example, a mini PCNL 1218 means the instrument cross-section is 12 French and the track diameter is 18 French. And probably this is the most suitable definition and classification of mini PCNL. Thank you for your attention.